These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, everyone, and welcome once again to CATHIP's Health Hour. It's a pleasure to be here. My name is Dr. Vanessa Appiah, and I'm your host for today. So I'm welcoming all of you to our regular listeners who make it every Saturday, and it's part of their weekly timetable, but also welcoming those of you that are spending time with us for the first time. So just a quick recap. So what is CATHIP? So CATHIP is the Caribbean African Targeted Health Improvement Program. And it's really a collaborative program. It's an educative program, and it's meant to empower our health literacy amongst our communities. And we want to reach people so that we're able to enable them to take control of their health, and not only their health, but the health of their loved ones, their families, their networks, friends, etc. And the CATHIP comes to you as part of a partnership, and the partnership includes the Caribbean and African Health Network, CAN, the Black Health Initiative, the Royal Assembly Redeemed Christian Church of God, RAFA International Development Agency, Croydon BME Forum, and the Enfield Caribbean Association. And these organizations have come together to really work hard to bring you topics that are really relevant to you so that you can live your best life. And it's for you, as I've said, and we're here to listen, but also we want you to engage with us as well. So we're listening to all our wonderful guests, but also it's an opportunity for you to ask any questions that you'd like. And if we can't get to the questions within the show, then there's an opportunity for you to write in the chat or email, and we'll make sure that we'll follow up with you. So just before I hand over to our wonderful guests today, I just want to say that we love hearing where you are. So if you are by yourself watching, or you're with friends and family, and your location, please put it in the chat, because it's great to hear that we're reaching people across the UK, but also internationally as well. And also to make you all aware that we are recording. So we want to make sure that people can watch again, and you can share the link with family and friends. But if you don't want to be seen, please make sure that you turn your cameras off. And without further ado, I want to introduce you to our fantastic speaker for today, Dr. Micheal Sapong, who is a dental surgeon, and he's going to be talking to us about dental issues in childhood and adolescence. And I always say, every time I'm on the Health Hour, everything is of much relevance to me, myself. And I have always tricky teeth growing up through childhood and adolescence. And I'm always really aware of it now that I'm raising my children. So I'm really looking forward to hear you speak, Dr. Sapong. So a big welcome, and over to you.
Thank you, Vanessa. Good morning. And I have to say, I have not up till now received such a beautiful introduction in all the work I've done and the places I've been to. But yes, thank you very much. Today's talk is going to be on dental issues in childhood and adolescence. Just a minute. Yes. Now, I chose this topic because of my strong conviction that children are our future, and we need to do whatever we can, the best we can, to give them the best lives that is available to them. Next slide, please. Now, it's a bit, just a minute. Yes. I'm going to start today with a few definitions. I'll describe what the natural progression of the mouth and perioral tissues should be from childhood to adulthood. We'll talk about a few things that, or some of the things that we see and are a bit alarmed by during the development of children, but are actually normal or explainable, and not to worry too much about that. And we'll also talk about some of the common disease conditions. Next slide, please. At the end of all of this, I would hope that we are all better informed and empowered to prepare our children for a healthy dental future. Next slide. Now, there's a healthy young boy, bright, confident, and looking forward to a healthy future. And I suppose that's what we want for all of our children, disease-free and confident. Next slide. A child, well, this is just a definition of what a child is a human being between the stages of birth and puberty, or between the developmental period of infancy and puberty. The word child may also refer to an unborn human being. Next slide, please. Now, we hope that our children go through happy childhood and end up as happy youths, as a prelude to adulthood. Next slide. And adolescence is defined as the stage of life when the youths aged 12 to 17 years mature into young adults. Right. Now, I put this in because it's just an indication of some of the things, well, of what happens to every human being throughout their life. So the child is born, and at the time the child is born, the child has inherited some of the generational embodiment or historical trauma of their parents. So child is born into the world. On top of that, depending on the social conditions into which they are born and the local content of those conditions, these will impact their lives from the get-go. So if you're born into a high needs environment with low provision of medical care, for example, then not everything is available to you to allow you to develop optimally. Adverse childhood experiences within this environment will also set the tone for the child's interaction and the child's development. Nutrition and disease and things like that can affect the neurodevelopment of the child. So remember, in the very early years, this is when the child is developing their nervous system and other systems to help them fight life, to help them, yes, interact with the world. If there's an impairment in this, then of course, social and emotional and cognitive systems may be impaired. This may lead to the adoption of health risk behaviors, ultimately culminating in disease, disability, and social problems. And that may mean that, well, we don't want to talk about death, but it may mean that the individual may not live for as long as they could have. Now, next slide, please. So with that in perspective, with that in context, let's focus on the teeth. Now, we expect normally that the child will have a good set of the primary dentition. The primary dentition includes, well, on each side, two molars, one canine, and two incisors. So the primary dentition will have on the bottom right, two molars, one canine, two incisors. Same for top right, same for top left, same for bottom left. There are problems here. Sometimes when the children are born, they are born with teeth. These are called natal teeth. And these are teeth basically of no real consequence, and they're very easily removed by a dentist or other health practitioner. The worst that happens is that mom gets bitten during breastfeeding, but otherwise the teeth themselves will fall out quite early, quite quickly, within a matter of days to weeks. Also, there are instances of delayed eruption where the teeth do not appear for a while. Your baby teeth will erupt between the ages of 6 months and 2.5 years, and sometimes it can be delayed. I would say if there are no teeth by the first year, then you need to start getting worried. Next slide, please. So the baby teeth are all designed to be shed and lost, and they're ultimately replaced by the adult teeth. The adult teeth, again, will have in each quadrant 3 molars, 2 premolars, 1 canine, and 2 incisors. For the purpose of this discussion, then I want us to conveniently forget about the third molars, because these appear at the end of adolescence and in early adulthood, and do not really sit within the scope of the period we're trying to talk about. Next slide, please. Between the adult teeth, well, the baby teeth and the adult teeth, there's a transitional dentition, and there'll be a period when you've got both adult teeth and baby teeth in the mouth. And I put this in because there have been many instances where mothers have come to me with their children complaining bitterly about the children's teeth not looking right, and so on and so forth. You'll notice if you look at the slide on the right side that the adult teeth are yellower than the baby teeth. The baby teeth sit more to the back in this case. And as they erupt, the smile does not look very good for a period. This is called the ugly duckling stage. And many unscrupulous dentists have actually taken people's money to put braces on children when they know the teeth are going to erupt properly. As an aside, it's generally not worth putting fixed braces on baby teeth because they're going to fall out anyway. So watch out for that. Next slide, please. Now, what are the main problems in childhood? Now, I'm splitting this into childhood problems and problems of adolescence, but there will be, well, there is a lot of crossover. So some of the subheadings will be discussed in both sections. In childhood, we've got caries, dental decay, and that's a huge huge public health problem all over the world. We've got craniofacial anomalies. Now, these result from lapses in development of the craniofacial complex. We've got developmental tooth defects, which are issues to do with aberrations in the size, the number, and the consistency of the teeth. Dental erosion, acid-based problems, dental trauma as well. Next slide, please. So now this slide shows what happens with bottle caries in young children. The 4 pictures on the right side are of the same child, and this is what happens when the child has been fed too much sugar for too long. So bottle caries typically arises with situations where the child is given a feeding bottle at night, with either a drink or with milk. Milk actually contains some sugar, so you have to be beware of that. And over time, you notice that the teeth decay, especially on the top jaw and at the front, until they are eventually lost. Now, if you're going to give your child a bottle at night, please make sure it's only got water, and also try and wean the child off the bottle by itself anyway. All right, next slide, please. Craniofacial anomalies. The most common one is cleft lip and palate, and cleft lip and palate is actually the second most common congenital disease. Well, no, not congenital. Yeah, the second most common craniofacial and not cranial. Just a minute. I'm having problems with my slides now, but yeah, they're the second most common birth defects after Down syndrome. There are other craniofacial anomalies which result in all sorts of jaw disproportions and things like that. But cleft lip and palate is the one to remember. Next one, please. Okay. Now, other childhood issues like thumb sucking, gum disease, which is very rare. And the important thing that I wanted to note here is that in pregnancy, it is important to still continue to see the dentist, because your oral health in pregnancy as a mother will be compromised by the pregnancy itself, and you have an increased predisposition to swollen gums and bleeding gums and such like. Remember, when you're pregnant, to be even more fastidious about your toothbrushing and flossing and your avoidance of sugar. There is some advice about rinsing with baking soda if you feel nauseous while you're pregnant. But that's something that I'm not an expert. It's something to talk to your health visitor or maternity people about. Okay, next slide, please. I put this in just to demonstrate that these are called growth curves, and there are about, well, you can see there's 4 of them. The ones that are really important that I want to highlight are the lymphoid growth curve and the brain and head growth curve. So you notice before the age of 2, a child's brain nervous tissues are growing very, very quickly. By about, say, 5, 6, and going towards 10 years the lymphoid tissues take over. And all of these have implications in the dental issues that we will see in childhood and in adolescence. Particularly between, say, 6 and 10, when the lymphoid tissues are growing, they tend to accumulate a lot around the throat. And when that happens, the lymphoid tissues grow and they look a bit like a cauliflower. The child is not swallowing very well, and all sorts of saliva and mucus, bacterially infected mucus are gathering on these lymphoid tissues. What that means very simply is that, and you probably notice, in the mornings, some of these children have a very, very bad breath. Sometimes mom will bring them to the dental surgery and say, my child's got bad breath. And we just have to reassure them that either if you are that really concerned, see an ENT person for an exam, or it's a normal thing that should resolve with age and with age and should be gone by puberty. Right, next slide, please. Now, what makes some of these problems in childhood better or worse are the behaviors of the caregivers, so parents, and also diet. So parental oral health behaviors will affect children's oral health. Parents who have poor oral hygiene, who do not get dental care, and whose diets promote tooth decay are more likely to have caries, untreated decay, and high levels of oral cariogenic bacteria. These behaviors will also affect their children. So children of mothers with high levels of untreated tooth decay are 3 times more likely to have decay as children whose mothers have no untreated decay. Similarly, children of mothers with greater tooth loss are 3 times more likely to have higher levels of caries experience as children of mothers with no tooth loss at all. So what this means is that we have to remember that in all things, we are mentors for our children. And if you want your children to achieve healthy, good oral health, then it's incumbent upon you to practice that yourself. Diet, again, very similar story. So diet during the formative years affects children's immediate risk for caries and their development of taste and food preferences that influence the risk for caries throughout their lives. There's been an association has been demonstrated between tooth decay and obesity. And children, for example, of low socioeconomic status are at increased risk for food insecurity, which is associated with lower vegetable intake and higher sugar intake. So again, your diet will be mirrored in the diet of your children by and large, to a very large extent. So that's something else to watch out for. Right, next slide, please. Now we move into problems in adolescence. Again, caries. Caries is a problem everywhere. In the adolescent years, children engage, well, they're adolescents now, they're not children anymore, engage in more sports and more physical contact activities. And that will result in more trauma to their teeth. Dental erosion. So things like acid reflux and vomiting will affect the erosion of the teeth, and with loss of enamel as a consequence. Gum disease, which comes from basically not brushing very well or poor oral hygiene practices. And I put in third molars. Third molars come towards the end of adolescence, and there can be problems with that too. All right, next slide, please. Yes, I just want to focus on caries at the moment, because you can't give any dental talk without talking about caries. And caries starts when plaque forms on the teeth, and plaque comes from well, plaque is always accumulating, so it's always a battle between the accumulation of the plaque and the removal of the plaque by toothbrushing. Plaque contains bacteria, and bacteria will feed on the sugar in your diet. So bacteria plus sugar will produce acid, and it is the acid that wears down the tooth. So it starts with a small cavity. So the picture on the right, on the left, sorry, the picture on the right shows 1, 2, 3, 4. So the first picture shows a small cavity into enamel. Now that is reversible, so long as it's within enamel. But when it progresses and goes into the dentine, it spreads fast and soon gets into the pulp. And once it gets into the pulp, you end up with pulpal infection and abscesses. And ultimately, if left untreated, the tooth needs to be removed. So we need to be very aware of dental caries and the effect of dental caries. It is a huge public health problem. Now, dental caries leads to pain. It leads to difficulty with eating, leads to problems with nutrition, and especially for young children, problems with development. And like I put, that's why I put down the that triangle earlier on. When you have problems with development, neurodevelopment, it just goes on and on and on, and it can have large and catastrophic effects on the eventual life, not lifestyle, but life course of the individual. Next slide, please. Right. Some of the other problems of adolescents: oral ulceration. So in adolescents, aphthous ulcers. Yes, aphthous ulcers will increase. Now, sexually transmitted diseases, so human papilloma virus. Most human papilloma virus infections are silent, but when they are chronic, then they can have associations with all sorts of oropharyngeal cancers later on in the individual's life. This is becoming more of a concern, and there are actually moves to start thinking about where am I again? Yes, thinking about vaccinating children or adolescents at 12 to 13 to mitigate against this. Malocclusion. So if you noticed when we spoke about the ugly duckling stage, as the teeth erupt and come into the mouth, there's always the potential for them to erupt in erupt so that the teeth are not in the best position for function and aesthetics. And at this stage, especially with adolescents, self-image and the self-confidence of these young people can be very much affected by the size and positioning of their teeth. Then there's sometimes a role for orthodontics, right? So these are things that you need to look out for with the children, with the young ones. Bad breath, again, we mentioned. We talked about the oropharyngeal bad breath, but with young people, the added items of importance are things like smoking and poor oral hygiene, simply not brushing their teeth well enough or often enough. Cosmetically, yes. This is a time as well where, especially for the young girls, the look and arrangement of their teeth becomes important. So teenagers are often preoccupied with their personal appearance. They start paying more attention to how they look and what others think about them. And chances are that teenagers will ask for treatment with crooked teeth, jaw misalignment, and diastemas, and things like that. So these are also things to watch out for. Next slide, please. Oh, I see. Okay. Seem to have come to this. Cutting through all of this are issues with anxiety and phobia. So many children, many young people will have anxiety about attending the dentist simply because of, well, their learned experiences, or because of unpleasant first or early experiences at the dentist. Now, this is something, again, as a parent, that you need to be a proper mentor in encouraging your children to attend the dentist. There are genuine cases of anxiety and phobia, and this picture on the right side is a book which is available on Amazon. It's about £2 for an ebook. I'm not sure how much it is for the physical 10-page book, but I bought one, and it's a very, very good resource for working through with your child, especially for the young child who is anxious about attending the dentist, to improve their appreciation of the dental visit and to make them a lot more comfortable. Now, next slide, please. Yes, and these days you can't, again, make a dental presentation without talking about how to find a dentist. So NHS dentistry is still facing huge problems with access, and more dentists are refusing to see new patients because they have no space to see them. Also, what is happening now is that your engagement with your dentist is becoming stronger. So if you don't attend appointments, you get taken off lists. If you fail appointments, you get taken off lists. So if you have a dentist, then it's important that you, especially if you want to have an NHS dentist, it's important that you have you pay attention to that enrollment and you keep up your appointments. This is CATIP is really set up to improve health inequalities between the Black and ethnic minority population and the general population. And I thought I would introduce everyone to the African and Caribbean Dental Association of UK. This is a group of dentists and dental professionals. It's quite a big body who are all of African and Black and Caribbean origin. They have a website. Website is the acda-uk.org, or just search African and Caribbean Dental Association. And from the point of view of people generally feeling more comfortable with seeing a Black, or with seeing a dentist who looks like them, then there's a directory when you go on their website, which advertises dental practices that are run by Black dentists all over the country. So if you think that's something for you, then by all means, please look at that. Next slide, please. Right, I think I will end by once again giving advice for good dental habits for life. This talk was meant to really describe the problems that, or the issues that you would face or you would find in childhood and adolescence. It has by no means been comprehensive. And one of the other things I have to admit to is that I've had problems with my slides through this, so I've just had to speak without recourse to my notes, which has dampened the experience a little bit. But for a parent who is looking to provide the best dental experience for their child through childhood and adolescence, then regular dental visits. You want to be visiting the dentist from when the first tooth shows through, which will be about 6 months' time. As dentists, we don't really expect much participation from children before the age of 2. But for the children, it's some sort of soft introduction and acclimatization to the whole dental experience. Regular toothbrushing. So a child-sized toothbrush and a pea-sized, well, for up to about 2 years, recommend just a smear on the toothbrush. 2 years and over, it's a pea-sized amount of toothpaste. And from maybe about 6 years and onwards, then you can use a bit more toothpaste. But certainly, you don't want to start using an adult toothbrush too early. The toothbrush must be soft, and you must follow, as much as possible, a good toothbrushing technique where you seek to brush every surface of every tooth properly, and you want to brush for about 2 minutes. And I think these days the advice, it keeps changing, keeps going back and forth, but the advice is when you've brushed your teeth to spit, don't rinse. Fluoride, very important. Fluoride in toothpaste helps protect the tooth against dental decay. When you attend the dentist, the advice is for the dentist or dental professional to apply a fluoride varnish to the teeth of children and adolescents up until the age of 14. So fluoride, it's quite clear that children who live in areas where the water is fluoridated have a far lower dental disease experience than children who live in areas where it's not fluoridated. Diet. Now, diet really boils down to the frequency and the amount of free sugars in your diet. You need to watch that. So as much as possible, you want to, for the child, keep sugar as a snack rather than as the main meal. And the longer you delay the introduction of sugar, the better for the child. Other aspects of diet, like green leafy vegetables and savory snacks instead of sugary snacks, will also help to reduce the caries experience and to improve general oral health. Yes, and as I've mentioned before, if you have a dentist, please communicate with a dentist. In today's world, especially on the NHS, they are at liberty to strike you off if they've not heard from you for a while. Communicate means attend your appointments and schedule them properly. Right, I think this may be the last one. Next slide, please. Yes, at this stage, I have to say thank you very much for listening. And also, I have to apologize that I couldn't give you as rich a presentation as I would have wished because of problems with my slides. I think there'll be opportunities for questions, and out of those questions, maybe we can give you some more information. Thank you very much. My number was on there. I make myself available to be contacted by anybody who wants to contact me, and there was an email address as well. Thank you.
Thank you so much. And we'll be sure to put your email and the number in the chat. But firstly, please don't say I'm sorry at all, because it was extremely rich and there are many questions coming through. So people are engaged, and people have been messaging me separately as well. So thank you so much, and looking forward to walking through the questions with you. So there was, yes, quite a few questions. So one of the things is you started to talk about it, and again, as I said before, it is making me reflect a lot. But someone's asked, just to reiterate, how often should their child brush their teeth? Is at night enough?
The given advice is to brush twice a day. Once in the morning and once in the evening. Over my years of practice, I developed, well, the advice I would give people was first thing in the morning, last thing at night. It doesn't really matter the exact timing, so long as you're brushing regularly and you're brushing properly. So I'd say first thing in the morning, last thing at night. And I used to also say something about pajamas. I don't know if people still wear pajamas, but I'd say when you put on your pajamas, brush your teeth. When you take off your pajamas, brush your teeth.
Okay. Oh, I like that. Yeah. No, but it's true. It's a good way, particularly with kids, just to add the structure to that. So yes, that's really helpful. And someone has talked about, which I think many parents or carers will relate to, is about thumb sucking.
Yes.
And they say that they've tried everything to stop it. What would you suggest? Any tips from you?
Well, generally, most children will grow out of thumb sucking. It tends to be a comfort thing. And I think, don't quote me on this, but I think it's something that sometimes starts in the womb, and fetuses have been observed sucking their thumbs. Most children will grow out of it. Technically, well, yes. Thumb sucking basically means that the bottom front teeth get pushed back and the top front teeth get pushed forward. So it will result in some speech anomalies. Certain words can't be pronounced properly. Generally, by age 8, most children have stopped sucking their thumbs. But after that, then you want to get concerned, because the front incisors, the top incisors, are now your permanent incisors. And you don't want them being pushed out of place too much. In terms of what you do to stop the child from sucking, I think there are behavioral therapists who are better placed to look at these things. Different dentists have tried all sorts of appliances, but to be fair, they just get in the way. So if you find that your child is still sucking their thumb after 8, 9 years old, then maybe you want to find the root cause of it and treat that rather than interfere with the habit itself.
Yeah, no, thank you. Really important. And someone's just asked, we've got a whole range of questions, but someone's asked, is it okay for a couple to share a toothbrush? I know my views on this, but this is, I'm sure my husband is.
So I don't have a professional view on that. Of course, if you share toothbrushes, then you're sharing everyone's got their own sort of crop of oral bacteria. So if you share toothbrushes, then you're just transferring between the two of you, and that's really what you're doing. But other people will say that, well, there's all sorts of other intimacy that goes on that does the same thing. But my personal view is that a toothbrush is a personal item.
Yeah. Thank you. You've helped me win an argument in my household. But yes, that's what I say too. But and you mentioned about fluoride, and someone's asked, is there any harm in having too much fluoride?
Yes, there's harm in having, well, that was one of the things I was going to talk about, but it skipped me. There's something called fluorosis, which is damage to your teeth from having too much fluoride. But that is really more important in childhood when the teeth are being formed. So yes, there is harm in having too much fluoride. But from the adult, after the teeth are formed, then the harm that you get from fluoride is more systemic than local to your teeth. And again, that would be something for your GP doctors to comment about. And also, I think that there's quite a long way to go before you start getting problems from too much fluoride. So from the point of view of the teeth, it's only important when the teeth are developing.
Yeah. Okay. Great. Thank you. And someone has sent a message about double rows of teeth.
Yes.
So her daughter has got a double row of teeth, and she's 6 years old. And is this common, and what normally happens?
Well, I haven't seen the daughter, but it's most likely to be at the bottom front, and it's usually because the adult teeth are erupting whilst the baby teeth haven't left. But
Right.
by all means, see a dentist. I might be wrong. See a dentist, and sometimes, very rarely, genuine cases of multiple teeth.
Great. Okay. So advising to see a dentist, and it could just be that everyone's fighting to come out and leave at different times.
Yeah.
But if not, it could be extra teeth. So, but either way, go and see someone to investigate it.
Yes.
Great. Lovely. And another question is about salt water. Adding salt to water to brush the teeth. Is there any benefit?
Not really. Salt is a mild antiseptic, and that's all it is.
Right. Okay.
Yes.
Fine.
So the toothbrushing itself will be of far more greater effect and significance than the fact that you put salt in the water.
Okay. Fine. Okay. Great. And someone's just sent a message just thanking you because from what I can read of the story, so their son had that ugly duckling face, which I went through, and went to go and see a dentist, and then advised the child had braces put on, but too early. And then it caused some trouble. So she was just kind of endorsing what you said and thanking you that just for people to just sometimes let the kids' teeth grow as well.
Yes, I accept that. Yes.
Yes, yes. Great. Okay. And someone else has said that sometimes a child sucks their tongue instead of their thumb, and it says that this causes the child to have a larger lip. Is this a myth?
I'm not
I think it's
sure.
yeah. I don't know. Sandra's on the call. If you wanted to ask directly, just to make sure I've got it right. But I think it's about sucking the tongue instead of their thumb. And does it cause the child to have a big lip?
I don't think it would cause a child to have a big lip. No. There's something called an endogenous tongue thrust.
Right.
Now,
Okay.
now we're getting a bit more interesting. But yes, an endogenous tongue thrust where some people, a very small proportion of people, when they speak, are always sticking their tongue out.
Mm-hmm.
And that would be something for the orthodontist to look at. If it's a genuine one, there's not much you
Mm-hmm.
can do with it. It's not,
Yeah.
it's not much you can do about it. It's just the way just the way the child is made, as it were.
Right.
But very often it's a habit that needs to be broken.
Great. Okay. Thank you. And someone else has put, sorry, as I said, questions coming in thick and fast. Someone else has said that they have had enormous difficulty getting a dentist, as you said. And they said, could you repeat the advice that you gave about getting a dentist in these difficult times?
Oh, well, look at first of all, NHS dentistry is declining. If you can afford to do so, then my advice always would be to find a dentist who you pay for privately, and you are likely to get a more focused service for yourself. If you do find an NHS dentist who takes you on, then remember that in these days, it's very important to have a relationship with them. So to attend regularly and so make sure you attend every 6 months or 12 months when they ask you to come. And when you make the appointments, don't fail them.
Mm-hmm.
Yeah. In spite of the difficulties with access to NHS dentistry, the local NHS commissioners, I know, are always doing their best to improve access in your area. So just keep looking. But once you found a dentist, please be nice to them so they'll be nice to you.
I like that. I like that. Great. Okay. And someone said, can feeding bottles affect the dentition of children?
Yes. Like I mentioned before, feeding bottle carries. So
Mm,
giving a child a bottle at night is not the best idea anymore. But feeding bottle by itself, used judiciously, should have the same, well, very much the same effect as a natural mother's breast. So
mhm.
I wouldn't say the feeding bottle by itself is the problem. It's
Yeah.
perhaps the frequency with which it is used and the manner in which
Great.
it's used.
Okay. That's fair enough. And I just wanted to give a shout out to Joy, who talked about her own daughter that sucked her fingers as well. And she's kind of teased us because she said what I did was kind of funny. But Joy, you didn't tell us what you did, so I'd love to hear. So if you feel ready to share, please let us know because I'd love to hear what you did. But we've got someone else who's just said that how to get her 5-year-old to clean her tongue without tears, and it's very, very difficult to do that. So any techniques? I feel you though, Effie.
Well, and not to worry. The whole thing about tongue cleaning is contentious. Half dentists believe in it and half don't really. It's the tongue by itself is self-cleaning in most situations. People worry about cleaning their tongue because it gets fairy and it can get a brown discoloration, and also it can contribute to bad breath. I just think 5 years is a bit, child is still learning, child is still developing. So if you want to go down the route of tongue cleaning with a 5-year-old, go gently, go slowly, and have a long-term vision.
Great. I like that. That's great. And Joy has been unmuted. So Joy, please feel free to share. We can't hear you, Joy. But let's let me just check if I think there we are.
Okay. Can you hear me now?
We can, Joy.
Yeah. Oh yeah, good morning, everyone. In my own daughter case, what I did, because when I gave birth to her, she started sucking her 2 hands right from birth. So sometimes she refused to eat. She just put her thumb on her, she just put her 2 fingers on her mouth and start sucking. Because I tried talking to other people, I was like, oh, you have to put this, put that, put that. I was like, oh God, I don't know what to do. Just give me an idea. There's this one day on Wednesday evening, she refused to eat for 2 days. What I just did, I just get an hand glove, like kiss hand glove, those hand gloves they normally wear when it's cold. So I just put it in her hand. Then I just like, you are not taking this hand glove away from your hand, you have to hold it. Then I just put the hand glove on her. Whenever she's going to take it off, I say, no, you're not taking it off. So I do that with her sorry, Elizabeth. I do that with her for 1 week to 2 weeks, and she just stopped sucking her finger because that glove was on her hand in the morning, in the afternoon, in the evening, going to bed. So I use that glove, I use that method, and I make sure that my eyes on her all the time, because when she's going to bed, she lies sucking throughout the night. So what I did, I just put her gloves on. I make sure there's a hair that can breathe through that glove because it was a netty glove I was using. Then I just put a little solid tape around the arm so that she won't be able to take it off. So during 2 weeks or 1 week, she stopped sucking. So right now she's 2+ right now. She's going to be 3 this year. She stopped sucking since last year. She don't even care to even when sometimes when I'm looking at her, she don't even put her hands in her mouth anymore. She just stopping. Within 1 month, she stopped. So for the lady that said for the lady that said that she had problem cleaning her 5-year-old daughter tongue, I have that same problem as well. What I did, you know, the cutty board, the cutty wool and cutty board.
Yes.
The flat and the round one that the kids used to wipe their face.
Oh, okay. So So a little like a sponge, is it?
Yeah, it's like not like this one, the round one that had that it's circle, the round circle one. It's normally sold in Asda or wherever.
Okay, I think I know what you're talking about. We'll have to.
You can just take 2 of it and wrap it in a 2nd or 3rd finger and make sure there's a water on it. So you can just easily wipe it through a daughter's tongue easily, gently, with toothpaste on it, and wipe it gently with the cotton wool. Through that process, everything is okay. Yeah.
Oh, I know, Joy. Do you know? Thank you so much. You brought us joy.
Yeah.
And I love this because this is the beauty of having the health hour. So we're hearing from professionals and each other within the community. So thank you so much for sharing, and happy birthday in advance for your 3-year-old. Yeah. Thank you.
Thank you very much.
So lots of tips and tricks there, everyone,
Yes.
just for some advice. I'm really aware that our time is going, but we do have a couple more questions, Dr. Sapong. I'll just race through them with you, if that's okay. So someone mentioned, so I think it was mentioned that there's a link between playing sports and teeth. And they've never heard of this before. Does this mean that if you participate in sports, you should use a stronger paste and brush or visit the dentist more often?
No. The sports bit is all to do with the potential for injury.
Right.
There's potential for injury, and especially in contact sports, and you find that more young people end up with broken teeth, broken jaws, things like that. Sometimes the teeth actually get knocked out. Yes. So my reason for putting that in was that it's something for parents to look out for and to be prepared for. Some
Yeah.
sports will encourage or maybe even mandate that you have a mouth guard for.
Yeah. I was going to say, yeah.
Again, adolescents, youth, they can be a bit boisterous sometimes. They get into fights and all sorts, or they just do physical activities that are likely to cause them to injure their teeth. But there's no prescribed sports toothpaste.
Yeah, great. Okay. Thank you so much. And just are electric toothbrushes generally better? Or mainly for those who don't want the effort of using a manual toothbrush?
There is no substitute for a good, proper handheld toothbrush brushing technique with a good toothpaste. However, it is almost impossible to get to that level of brushing your teeth very, very effectively. Well, no, it's not impossible. It's a hard thing to do, to get around all the different parts and so on and so forth. So put that to one side. Electric toothbrushes are basically a motor and a brush. So if you have a brush, a good quality brush and a good quality motor, it makes the electric toothbrush better than one which has a hard coarse brush and a coarse motor. Over time, the electric toothbrushes are always improving. And again, I wouldn't have the market research to hand, but I would suspect that today, if you got a good electric toothbrush, and the quality usually goes with the price, not purely, but if you get a good quality electric toothbrush and you follow some of the programs that come with these electric toothbrushes, you will be doing better generally than having a handheld toothbrush.
Great. Okay. Thank you. I think I'm sure there's many people who often reflect that. They're just thinking, you know, are they better, or is it that I just need to put a bit more work in brushing my teeth by myself?
Yes, you can get an electric toothbrush for £15. You can also get one for £300.
Yeah. My mum is always very vigilant. She uses her electric in the morning and she does it herself at night. That's just to split the opportunity.
Yeah.
And I think there's just one last question that I wanted to ask, and it's a reflective one as well. And many people, I'm sure, have been offered this opportunity. So Juliana has written that how effective are dental teaching hospitals in dealing with treatments that refer to them, especially because it's students that are typically carrying out the treatment, although they are under supervision. And yes, but I know from personal experience that I've been looked after by student dentists, and I had wonderful care, and they had great supervision. But I also knew them because they were dentists that were training with me whilst I was doing medicine. So there was this added advantage that I had. But just to give some reassurance, Dr. Sapong.
Oh, It's
or not?
it's no. It's much of a muchness. So we live in the UK. Dental regulation is at a very, very high level. So anybody who has a license to practice will generally be practicing at a very high level. In the dental hospital, like you say, it's the students who look after you. But at the same time, they are doing that under conditions of best practice. So I wouldn't make a distinction or I wouldn't have any greater expectations, except to say that, yes, at the dental hospital, you would tend to have a lot more facilities at your disposal than if you went to a dentist on the high street, and techniques and things like that.
Yeah. So it's, being assured, because the students are under supervision, and there could be excellent opportunity to have more access to different treatments that you may not get in the high street. So no, I think that's
for example, if you went to the dental hospital, that's when you might get an implant for free.
Yeah.
Instead of if you went to the high street, somebody charging you £2,500 for the same thing.
No, completely. And I feel I can't end without, because the electric toothbrushes have come back on, but
Come back again. Okay.
How can you clean your tongue properly if you have an electric toothbrush? That's our final question.
Well, I couldn't answer that, but I'd expect the same way as you would clean it with your handheld toothbrush.
Yeah. With vigor and energy.
Oh. But there are other things. There are tongue scrapers which you can buy.
Yep.
Which should actually do a much better job than the toothbrush.
Yeah. Okay. Great. Well, Dr. Sapong, thank you so much. You can see that this is a much needed conversation and education. I think it's, I'm sure you're aware that the focus on teeth isn't always there. And so it's great to have an opportunity to have someone like yourself just take the time to walk us through and give us an opportunity to get those questions off our mind that, sometimes you may be a bit shy to ask your dentist, or you're too scared to go to your dentist and to go on to that. So yes, thank you so much. It's been a complete pleasure to have you on. And do you know what I love, Dr. Sapong? People are sneaking in questions.
Yeah. If you've got the time, I've got the time for you.
Yeah, okay. Well, we'll do one more question. I love it. Someone has said that they've suddenly developed a gap on their upper front teeth. Is it due to age?
It depends how old they are.
Yeah.
Yes, it depends how old they are. There are genetic. As you grow older, your teeth tend to move. So there are natural movements that occur with aging. So if you look, a lot more people, anybody who's 20 years older than you and that cohort, you'll probably find that you look at them and their teeth are more crooked than yours are. So there's that. Now, also, when teeth move suddenly, then there tends to be an underlying cause, and maybe this person needs to get their dentist to look at what's going on.
Yeah. Okay, great. That's really helpful. Thank you. I think we really are going to end there, but extending a huge thank you to you, and also thank you to everyone that's participated, asked questions, your time just being here. We don't take it lightly. Joy, thank you for personally sharing your experiences as well. It's fantastic to hear. So I just want to now hand over to our colleagues at Khan, to Micheal, who's going to kindly take us through some advertisements. So thank you again, Dr. Sapong, and over to you, Micheal.
You're welcome.
Thank you so much, Dr. Vanessa. So we'll go straight into our slides, and I'll just share my screen. Please bear with me. And There we go. So thank you so much for joining us again today. This was our CATIP Health Hour, and it's been a fantastic session. It's happening every single Saturday from 11 till 12:15. Please, please share this with your friends, family, work colleagues, and anybody who you might just come across. You know, it's a very informative session and they'll get so much out of it. Every single Tuesday, we have our Healthy Hearts hosted by our wonderful Dr. Hiba, and it's led by an amazing team of Black nutritionists, somebody different every week. It's 6:30 p.m. till 8 p.m. And we also have our physical instructor, Orlando Grant, who'll take you through a 30-minute workout as well. So please share that. If you want to register, the email is on screen, events@carn.org.uk. There's also a chance to ask questions too. Yeah, please get ready. Put this date in your diary. It's going to be absolutely wonderful. We have International Women's Day. We do a wonderful flagship event every year. And this year is going to be a conference and workshops, networking and dinner. And it's going to be a fabulous celebration for all women. And the theme this year is womb health and wealth. So that's everything to do with the uterus. So we hope you can join us. It's at the Lancashire Cricket Club. There is a phone number on screen for more information. Please get your pens out, write this number down. It's 077 10 022 382. So yeah, please join us. We'd love to see you all. And bring your husbands, partners, and the men too. They're also welcome. We have an amazing project that's happening in Gorton, and we really need to hear the voices of all those who are affected by private housing conditions living in Gorton. We've got an official launch where we are supporting the improvement of housing conditions and amplifying the voices of those private tenants. So if you know anybody who's living in conditions that they shouldn't be living in, or have had issues with private housing conditions, we want to hear from you. We want you to join us actually at Gorton Library, which is located in the new Gorton Hub on Friday, the 1st of March. So that's not too far away. So we hope you can make it. Please share with anyone you know at all who lives in the Gorton area. So how's your lung health check? If you are living in London or know anybody who lives in London between the ages of 55 and 74, there's some specific areas mentioned: Barnet, Camden, Enfield, Haringey, Islington, and they smoke, or they used to smoke. We want to give them a health lung check. So please, if you do know anything, please, there's a website there. Go on to that website and you'll find a lot more information about getting a lung health check in London. And that will actually maybe, prevent any further damage. Here at Carn, we have our legal drop-in sessions. They happen every 4th Thursday of the month. So that's the last Thursday, or no, in some cases not, but the 4th Thursday of every month. And they are 6 p.m. to 7 p.m. You can come along if you've got any questions at all to do with anything legal. We've got an amazing advocacy team and legal team on hand to answer your personal questions. So if you are interested in that, there is a helpline number. And, if you've got your pens at the ready again, it's 07710 022 382. Please do get in touch. Okay, we've got our diabetes peer-to-peer support. This is a new project that we are working with the Manchester Local Care Organisation. The first Monday of every month and the 4th Monday of every month, we're in 2 separate locations where they're going to be a peer-to-peer support group. So if you are affected by diabetes or know anybody else who is, and you'd like to get together to speak with others who are going through the same thing, this is for you. It's happening every first Monday in Newton Heath Library. and that's 5 till 7. And then it's happening every 4th Wednesday at the Simpson Memorial Hall, and that's in Moston, 5 till 7. There's a number again on screen, and indeed my colleague's email, abundance@carn.org.uk. You can send an email, or again, there's a number, 0777 4994 178. Please do get in touch if you'd like to join that peer-to-peer support group. Sounds amazing. And yeah, we have a wonderful Black Health Inequalities Summit on the 25th of March. This is one that please put this date in your diary, book your coach ticket if you're in Manchester, and let's get down to London. It's going to be an amazing event, an amazing summit, and it's all about the community and systems collaboration approach to improving the health of Black Londoners. And that sounds really something that is really insightful, and we should be a part of it. So we've got speakers, Professor Kevin Fenton and Professor Bola Owolabi and Professor Habib Nakvi. So please, some really amazing speakers lined up there. So thank you once again for joining us today, and we hope to see you all next week at the Health Hour. Goodbye.